So I'm Dan Lax. I have a Master's of Science in Environmental Health Science from UC Berkeley. I decided to look at what would be the effects of chronic mercury exposure on the human population. What this study found was that chronic mercury exposure was rising over the years 1999 to 2006 within the U.S. population. And this rise went from 3% of the U.S. population to almost 30% of the U.S. population having detectable amounts of inorganic mercury in their blood. Now, inorganic mercury is a specific form of mercury, either made from organic mercury, which gets demethylated to this, or it's also made from elemental mercury, such as you get from dental amalgams, which gets catalyzed to it. And these deposits of inorganic mercury actually get deposited in different tissues of the body and stay there for years. So not only was there an increase in this chronic mercury exposure, but this chronic mercury exposure was at a level that was sufficient to elicit a biological response in the liver, the immune system, and the pituitary. So I looked at those three areas, and I looked at biomarkers that indicated function for those three areas, and all three areas were associated with this chronic mercury exposure. So the immune system, the biomarker I chose was white blood cell count, and that was inversely related to chronic mercury exposure. So if you have chronic mercury exposure, you're going to have immune function problems, and this has already been shown in vitro and in other toxicological studies. And in addition, the same was true with bilirubin and albumin, which both biomarkers of the liver function and associated with lots of diseases. And most strikingly, and most novel finding of this study was the association with luteinizing hormone, which is secreted by the pituitary. And now why this is important is because luteinizing hormone, and this was my second paper that I published on this subject, was that luteinizing hormone provides a causal mechanism for mercury-associated disease. Luteinizing hormone is in a place where mercury is deposited in the body at a much higher rate than other regions of the brain, at 200 to 300% higher. It basically provides a mechanism for all of the associated symptoms and morbidity associated with mercury exposure and their associated diseases. Our chronic mercury exposures have reached a level that is having a significant biological effect. And not only that, but it is having an increased and elevated risk for our population and for individuals over time. It seems obvious to researchers in the field that it's a growing health risk that needs to be addressed. Not only that, it's a political issue that is being stymied. So without a change in the political environment, science and the human health is really at risk.